So chronic illness and disability have a negative effect on sexuality, which leads to a decrease in the quality of life in women with MS and SCI. Sexual consequences of MS and SCI can be organized in terms of primary factors, which result directly from the impact of the disease or the injury, secondary factors, which are indirect factors associated with the condition, and tertiary factors, which are related to body image changes and altered perception of sexual self. So the purpose of sexual rehabilitation is to facilitate sexual adjustment, which refers to changes one might make to move towards a positive sense of sexual well-being. So the purpose of the current intervention is to offer an existing intervention tool to women with MS and SCI. It was originally developed and found to be effective for female cancer survivors and more general population of women experiencing sexual difficulties. Intervention was modified for the current population in 4 ways. It included information regarding the prevalence of sexual difficulties in MS and SCI populations. It included body mapping exercises, description of female internal reproductive anatomy, and mindfulness practice of observing judgments. The participants were 6 women between ages of 19 and 65, living for at least a year with MS or SCI. The intervention consisted of 5 90-minute sessions spaced 2 weeks apart, completed within a 10-week time frame. Questionnaires were given to participants to assess the primary and the secondary factors immediately prior to, following, and 6 months after completing the treatment. The groups were co-facilitated by a sexual health clinician and a registered clinical counselor, and homework exercises were given at the end of every session and discussed at group session. The group intervention combined elements of education, cognitive behavioral therapy, and mindfulness-based therapy. And following treatment, a research coordinator conducted a focus group with 3 study participants and 1 clinician, and qualitative feedback was obtained from these groups. So the findings of the study show that it was difficult to recruit women with SCI because of accessibility issues. Intervention was found to be beneficial in improving sexual function in women with MS and SCI. It also improved their sexual self-view, which refers to how a person is able to define themselves as a sexual being in light of their disability. The intervention satisfied recommendations from previous studies, peer support, group format, and access to healthcare professionals. In conclusion, the intervention, specifically the mindfulness-based practices and peer involvement, is beneficial for women with MS and SCI, and future studies should consider the development of an online version of the intervention with a group chat or peer mentoring portion to address accessibility issues in this population.